Hi there.
Hi.
I'm Luke Maley. I'm a student physical therapist at the University of Cincinnati. Is it okay if I work with you today?
Sure.
Great. And can I get your name and date of birth, please?
My name's Erin Jones,
Okay.
and birth date is 7/26/1993.
Okay, and also can I have your height and weight, please?
Sure, I'm 5'4", and I weigh 120 pounds.
Okay, and did you sign the informed consent when you came in?
Yeah.
Great. And also, are you right or left-handed?
Right-handed?
Right-handed, okay. And did anybody refer you today to physical therapy?
My doctor, Dr. Smith.
Dr. Smith. And when did you see Dr. Smith?
About 3 weeks ago.
Okay. And are you planning on seeing Dr. Smith again?
Yes, in 2 weeks.
In 2 weeks you're going to see him again. Okay. And did Dr. Smith give you a diagnosis or a reason that he wants you to come into physical therapy today?
Yes, let me try to remember. It's, I think, spondylolisthesis.
Spondylolisthesis?
Does that sound right?
Mm-hmm.
Okay.
Okay. And what were you doing that brought upon the spondylolisthesis?
Well, I'm a gymnast, and there wasn't one instance that I remember this happening, but I was at practice about 4 weeks ago, and we were on the floor exercise, and we were doing some tumbling passes, mainly front tumbling, and I noticed after tumbling for about 20 minutes, we were about to move on, and I felt a sharp pain in my low back on the left side.
You said it was a sharp pain?
Yeah.
And I'm not very familiar with gymnastics. What is front tumbling? Did you land on your back or did you land on your feet? How did you land when you felt this pain start to come on? How were you landing?
I was landing on my feet, but in front tumbling, it's more, you're taking off more back than forward.
Okay.
So
You landed on your feet, and then from repetitive over and over, you start to feel this pain in your back.
exactly.
Okay. And what would you say your pain level was once you started to feel this pain come on a scale of 0 being no pain and 10 being, the worst pain that you could tolerate, having to go to the emergency room?
Okay, I'd say probably about a 7 out of 10.
7. And did this pain persist after the injury, or did it kind of dissipate?
It started to dissipate. I continued to practice that night just to try to push myself. I didn't want to make a big deal out of it. But then the next day when I went back to practice, it was worse. I could barely, even run on my back with that pain.
So would you say that what would you say the pain increased to then after that, when you went back and tried to do it again?
Probably an 8 or 9.
8 or 9. Okay. And what type of activities, you said that it got worse, what type of activities made the pain worse? Was it just strictly gymnastic stuff?
At that level, the 8 out of 10, just gymnastic stuff.
Okay.
Yeah.
And is that mostly landing on your feet again?
Right. Pounding type activities.
Pounding, okay. Are there any other activities during the day that would make the pain worse, that you would notice, just kind of daily routine type of stuff, not just gymnastics?
Right. Probably standing for long periods made it a little sore, and sometimes bending backwards.
Bending back. And what would the pain be when you were standing for a long period of time or bending backwards?
Probably 3 out of 10.
So not too bad compared to gymnastics.
Mm-hmm.
Okay, and just so I can kind of get a generalization of the pain, do you have any pain when you're bending at all from side to side?
Not really.
What about when you're standing and then going to sitting, or going from sitting to standing? Is there any trouble doing that?
No.
Okay, and do you have any trouble going up or down stairs at all?
No, not really.
Is there anything that you're doing that you did after the injury and are doing now that helps the pain get better, lessens the pain?
I tried using an ice pack and taking ibuprofen, but that didn't seem to do all that much.
Yeah. Okay. And are you having pain at night since the injury?
Just a little bit, just from moving around and standing for most of the day. It's a little bit worse at night, yeah.
Okay. And is this pain keeping you up at all?
Not really.
No. And would you say that the pain gets worse throughout the day as well, just from standing all day, or
Yeah, a little.
just daily routine?
Mhm.
And I'm assuming that you sit for a good majority of the day since you're in school right now.
Exactly.
Okay. Do you have any numbness or tingling associated with this pain in your lower back? Like in your leg or in your arm? Have you noticed that at all?
No, not really.
Have you noticed any swelling in the area?
I don't think so, no.
Okay, what about stiffness in your back? Does it feel tight?
Yeah, somewhat.
Okay. And do you feel like it's kind of loose or unstable?
No, it feels more stiff than unstable.
What would you say that your pain level is at now? Just on a, just
Right now, just sitting, it's really only like a 1 or a 2.
okay. It's not too bad. And after you started feeling this pain, I know you said you went and saw the doctor a couple weeks ago, but did you do anything right after the injury? Did you go to the ER or the hospital or see a doctor?
No, I didn't see my doctor till probably 4 or 5 days after I noticed it.
And when you went and saw Dr. Smith, did he run any tests?
Yeah, he did an x-ray, and then I also had an MRI done just to confirm that that's what he thought it was, the spondylolisthesis.
Okay, and that confirmed it.
Right, he said that he found a fracture in my lowest vertebrae and also a slipped disc in the same area.
Okay. And are you wearing a brace or anything right now for your back to help the pain?
No, I haven't tried that.
Okay. Also, do you live with someone that could help you, move around if you needed to or assist you since you're having this kind of pain in your back?
Yeah, I live with my parents and I have a younger brother.
Okay. I'm going to ask you a series of questions regarding your past medical history just to help us better diagnose your problem and create a treatment program for you. Do you have a history of cancer,
No.
diabetes,
No.
heart disease,
Mm-mm.
hypertension or high blood pressure,
No.
arthritis,
Nope.
osteoporosis?
No.
Do you have any type of metal implants?
No.
What about psychological disorders?
Nope.
And do you have a history of epilepsy at all?
No.
Okay, great. And kind of along with this, also, we typically ask if you use alcohol or tobacco on a daily basis, and that, again, just helps us design a better treatment program for you. So do you use alcohol or tobacco on a normal basis?
Neither.
What would you say that your goals are for physical therapy?
I would say mainly just to get back to normal practice and competition for gymnastics.
Okay, so you're really probably itching to get back, aren't you?
Yeah.
Okay. And is there anything else that I should know about this injury or how you did it that would help us in this process of trying to figure out what's going on with you?
I guess just the fact that when I was front tumbling, I did kind of land a little bit back on my feet, and that I continue to practice. I don't know if that made it worse or anything like that.
Mm-hmm. And you said that you continued to practice after, even though you felt the pain, but you still kind of tried to fight through it.
Mhm.
And all the pounding and stuff kind of makes the pain worse. We
Right.
tried icing it and ibuprofen, but that didn't work. And pain's not too bad during the day.
Right.
Correct. Okay, and one last thing, are there any other conditions or surgeries that you've had in the recent past that I should know about?
Let's see. I had my tonsils out when I was about 6. And then I also broke my arm when I was 9. And that was also a gymnastics injury.
So that was about 7 years ago.
Mm.
Great. Well, thank you today for coming to see us. It's
Thank
nice
you.
to meet you, and
You
we'll
too.
hopefully get a treatment program for you.
Awesome.